So you've heard me talk a lot about Fred as an adult, but in reality, this happens for children too, and it happens for children a lot. The thing though is that a lot of pediatricians are not aware or can think of sleep disorders in children. There's a really good movie called Finding Connor Deegan, where the mother actually shows and shares the story of her child who was really problematic, to say the least, and they found out that his main issue was he wasn't getting any oxygen at night and actually during the day either. And they actually did appliance therapy. So this is one of the most important things that I think as a dentist I can share with any mother. First of all, when the child is born, make sure that there's proper development of the arches. The first thing you want to look at is tongue position. Is the tongue where it should be? Can the child nurse appropriately? Look for a tongue tie. If there's a tongue tie, have it addressed as soon as possible. And it could be at the hospital, it could be an ENT, it could be a dentist. What they'll do is they'll allow that little tongue, once they nip that little tie, the tongue can now go to the roof of the mouth, and there's a rhythmic motion that actually helps the nursing milk go back to develop a proper swallow. But more importantly, it'll also develop the palate. And guess what? It'll also develop the cranial sutures, because remember, they're not fused. So that's the first really important thing, is to have a proper swallow, proper nasal breathing. The second thing for a child is make sure that they actually can breathe properly through their nose. Look for any allergies, any shiners. You know, I have a lot of allergies, so unfortunately I look tired all the time, but I work on that. I work on diet. That's a really big thing. Unfortunately, a lot of children can be reactive and react to dairy. So watch out for that. Watch out for dust, for moles, for mites, dust mites, anything environmental, anything that they can ingest. Plush toys, animal dander, anything that that will cause nasal passages. As a child, I grew up in the Caribbean in a house infested with humidity and scents and smells that constantly had me with allergic rhinitis. I went ahead and I developed a very deviated septum, and later on in my life, I ended up having therapy to enlarge my palate. But that's later on in life. I was already in my 50s when I did that. As a child, we can do that. We can do that at the very beginning. At the very beginning, again, tongue position with a palate when they're nursing, all the way through their childhood. When they start getting teeth at 2 and 3, we can develop arches. Even before, Dr. Nordstrom has created neonatal little rhythmic trays to go ahead and to help neonates to be able to develop. So it could go anywhere from any age on up. There's a wonderful website you can go to. It's called the ALF Interface. Please visit. Dr. Derek Nordstrom has amazing information. The doctors who are trained in ALF functional appliance therapy are well versed and well trained, and are very knowledgeable in cranial motions and what we actually can do to help patients who need the best help to be able to breathe and swallow. That's really important. Remember, coffee stirrer, fire hose, which would you prefer?